are you?
Oh, thank you.
Nice to see you again.
Nice to see you too.
Yeah. All right, so I'm just gonna have you sign some consent forms,
Okay.
and then they're gonna take you downstairs, and they're gonna make that mask,
Okay.
like I explained, and then they're gonna do an MRI.
Oh, good. To double make sure check
Yes.
the MRI today. Good.
Yes.
I'll feel better with that
And
too.
you are improved. They did get insurance approval,
Okay. Okay. Good.
so that's great.
Good. Good. Good.
And then I think you're supposed to have a visit with Did you meet with Dr. Schoaf or Dr. Katari today to sign consent for that?
Not for that. We haven't done that.
Okay.
Have we?
We unfortunately didn't make it today.
Okay.
We'll have to reschedule.
Okay. Do you okay. And then I think they'll call you to do that. Yeah.
And we're trying to get we were talking to the people, the group that handles the medicine, for the pain.
Yeah.
To see if they can get that. So we talked to them some yesterday. They went over and double checked what we had, what we're out of. So
The support
hopefully that'll go forward. Yeah, because I just have a lot of pain still. All right.
No, he's completely out of his morphine sulfate. And we didn't know about the steroid, if he needed to continue taking that.
I would continue taking the steroid for now.
That's all right. Okay.
Yeah. Do you have enough?
Do we still have any?
No.
We're out, aren't we? Yeah.
Are you out? When did
Yes.
you run out?
Oh gosh.
A week.
You've been out a whole week, and are you having when you were on 2 milligrams twice a day before?
I'm not sure, but
Okay.
it was twice a day.
Yeah, I think it was 2 milligrams. And has anything changed since you came off the steroids? Are you having any more headaches or weakness?
Well, the headaches. I mean, I still have. That's basically stayed the same. My headache.
So it didn't get worse when you stopped the steroids?
No, it's still there. It's still about a 7 or so most of the time. Right, it's usually in the front lobe area here. Even right now, if I move it, sometimes the pain will just kind of peak, and I just kind of have to find a good restful position at night, But if we had the morphine, at least that would help. Because I would sometimes wake up in the middle of the night and just have the pain, and that would help to kind of make it so I could get back to sleep again, without the pain as intense. So the morphine did help to cut some of the pain.
The headache started after the surgery?
Oh yeah, that's when it was after surgery that they really kicked in. But it was because it was on the right lobe area here, back here, and then it's more now focused more on the center, with that little other mass could be, or they're not sure what it is, on my frontal lobe. There's something there, but they don't know what it really is. So.
Yeah, I wouldn't expect that one to cause you headaches, though. Have you talked with your neurosurgeon about these continued headaches?
I had to go back.
No, we have a post-op visit with him on May 26th.
Okay, good.
But
next week.
Yeah, I can't even remember now if you had headaches before the surgery. I think you did.
Well, I've always had some, but after the surgery, it got worse. I was in the hospital and they were monitoring
it. Down at all.
Yeah.
No matter with the pain meds or anything. From what I know.
Yeah.
Yeah, I would definitely talk to your neurosurgeon about that, because I think I mentioned before, it's unusual to have such severe headaches that you require narcotic medication.
That, right. So we'll see when we see him again. I can go.
Make sure nothing's.
Yeah, that's what I'm getting right. Exactly. That's why I'm glad they're at least doing an MRI just to make sure everything still looks okay there, because we know the glial thing can go pretty quickly. Things can happen fast.
So if you've been off the steroids for a week and you haven't noticed anything change for the worse, then we can just stay off them for now. I'll review your MRI today.
Okay.
And then I'll send them in if I think you need to be on them. Okay. You did have a good resection of, the dominant tumor, not the little one in the front, obviously.
Right.
So maybe you don't need them long term. And so if you don't need them, You know, generally we try to slowly take you off anyways and get you to a point where you don't need to be on the steroids just because they can have their own side effects.
Right.
So,
Yeah.
we'll just leave it as is and only put you back on them if there's like more swelling or something. like
Yeah,
that.
okay. I think that's what someone had noted somewhere. They said if because we came off of it pretty quickly, it was just a quick stop, we ran out. So somebody, there was some note somewhere where they said we could restart and then wean off of it again, but
Yeah, Dr. Sharp said that.
if it came to it.
Didn't I already have you sign all these consents?
I think we did a bunch of signatures, a bunch of consents that day.
That day.
Yeah.
I'm like, just
I
occurring
remember.
to me that you already signed all these, I'm pretty sure. Let me check, 1 second.
Okay, sure.
Wait, I think they are.
I think he signed everything already. A couple of weeks ago.
Okay,
Yeah.
you did sign them, I'm like, I need to have you re-sign them. Have you ever used gabapentin? Has anybody ever put you on that for the headaches?
You do it for sleep, don't you?
Huh? What did we have, Gavin?
He takes 2 gabapentin every night, so.
Okay, oh, sure.
Help to go to
And,
sleep.
and a doxepin at night.
Oh, okay, okay, you already know. I was just gonna say that could help with your headaches and that might be better, like long-term in terms of treatment.
So, but he's been on the multi-sulfate since he got out of the hospital
Yeah,
twice a day, and, he has, Percocet to take,
uh-huh,
every 6 hours.
yeah.
If he needs that, can he take any, are you're suggesting that he just doesn't take any of that? Or,
Well, if you have Percocet left and you feel like you need it, then you can take that, or you could try Tylenol or ibuprofen or
okay,
the gabapentin that you have can be redosed. I would rather you talk with your neurosurgeon though than we just keep giving you narcotics because, like I said, it's not. You know, I don't want to like have your pain be. I'm not trying to ignore your pain at all, but I just don't want to like mask pain that maybe there's something else that needs to be done. You know?
Right.
But if you just you can use the Percocet as needed, and
Yeah.
and maybe you'll find out you need less of it than you thought you did.
okay.
Sorry, let me take this real quick. Hello?